The Y is at the forefront of making crucial changes for people and their communities so they can all have the opportunity to live healthy lives. As my kids were growing up, they went to Camp Orkila in the summer, and I'm eternally thankful to the Y to give them that opportunity there. So it's really a great pleasure to be here with you tonight to talk about what the forces are in our communities that make people healthy or not. As a health professional who's dedicated my career to making people healthier, it's a real honor and a privilege to get to come here tonight and share some thoughts with you this evening. So thank you. So when we think of what makes us healthy, what comes to mind? Is it healthcare? Is it our genes? Or is it our habits? I think a closer look suggests to me that really the fundamental and underlying things that matters is where someone lives, works, learns, plays. The social and physical characteristics of those environments and communities is the most powerful force that determines our health trajectory through the course of our life. Let me give you an example of that. This map, I hope you can see, probably can't see it in the back, but I'll try to explain to it. This is a map that shows life expectancy in King County. And the lighter colors are longer life expectancies, and the darker colors are shorter life expectancies. And there's a gap just within King County of 10.4 years in what a person in North Seattle might expect to live and what a resident down in Auburn might expect to live. And that's a pretty profound statement. We all want to be healthy. What determines our health? What sets up disparities or inequities in health as we see it in this picture here? Medical care, how many people think medical care is an important determinant to the health? Good. What about your genes? Okay, and what about your habits? We've heard a lot about the habits. Okay, I think I saw a lot of votes for that. Okay, well, when you look at the data, it turns out that healthcare accounts for maybe 10, 20% at the most of the health of a population. So if we take the next layer down, how about our habits? Behaviors that affect, like what we eat. How physically active are we? What do we smoke? These are really important. But then we have to ask a deeper question. Why do people adopt certain habits and health-related behaviors? What makes it easy or hard to practice these behaviors? How many of you would try to change your diet and eat healthier? I expect most people in this room, right? Okay, and a year later, how many of you have been able to stick with that? Much fewer. Okay, so it's hard stuff. It's really hard stuff. How about getting enough physical activity? How many made New Year's resolutions? And how many kept your resolutions? So it's hard. So we all are challenged by trying to maintain these healthy behaviors. So from my perspective, what I've learned over these last 25 years, 30 years working in this field is whether people can adopt and sustain healthy behaviors is to a large extent determined about where they live, where they work, where they learn, where they play, what their environments are, and also their resources, what their income is, if they have jobs, wealth, education, if they have social support. So let's take a look at these and how these kind of attributes which affect health are distributed across King County, and I think a remarkable pattern emerges. So here is the same picture, and this is a little bit hard to see in this light, so I apologize for this. But again, what this is showing, this is the prevalence of diabetes, how common the rate of diabetes is across King County. The darker areas, which aren't showing up so well in these pictures, are the ones with the highest diabetes rates. Well, it turns out the highest diabetes rates are also in South King County, same place that we saw the lowest life expectancies. There's a twofold difference in the diabetes rates between North Seattle and the communities of South King County. We can take another example of obesity, same pattern, clustered in Southeast Seattle, South King County. No matter what health indicator you look at, preterm births, et cetera, you'll see the same pattern. So why should all these different types of adverse health conditions be clustered in the same communities? Well, you can take another look here, and you can look at how the health behaviors we've been talking about cluster again in these same communities. So if you look at the folks eating less than 1 serving of vegetables a day, much higher rates of people with low vegetable consumption in South King County. If you look at not meeting physical activity recommendations, we see the same picture. And if you look at cigarette smoking, same picture. So across a wide range of health behaviors. Why all in these same communities and not in other communities? If we could figure that out, we could make great strides in improving health equity in our communities. Well, let's go down one more layer here and look at some of the social factors that might condition these behaviors. Income, Poverty is now concentrated in South King County with the gentrification of Seattle. People are moving south. This shows that the concentration of folks whose incomes are less than 2% of poverty is in South King County. What about being able to afford enough food to put on your table? Food insecurity. Much higher proportion of the population is food insecure in South King County. Same thing with limited or no social support. People are less connected, less supported if they live in South King County. And they're less able to afford housing. High housing costs where people spend more than 30% of their money on rent. Many more people are in that bucket in South King County. So it's really a striking pattern to me as a physician and epidemiologist to say, look where life expectancy is lowest. Look where obesity rates are highest. Look where the health behaviors that condition people to be unhealthy are highest. Look where social determinants and social factors that affect health are most adverse. All in the same places they cluster. So to me, that says that the answer to that question that I posed originally is that, is it your DNA? No, it's actually your zip code is more important than the genetic code in determining your life health course trajectory. So putting this all together, the conditions that determine health are really, and drive our behaviors, are really where we have to go to make our communities healthy and therefore the people living in those communities healthy. So what is it, though, about your zip code or your neighborhood that's such a powerful influence on health? Some might say, well, it's because different people live in different zip codes and different people make different choices, and so that's what's driving it. But I think if we consider this more deeply, let's ask ourselves the question, what drives people's choices? What drives the choice of what behavior they adopt or what they practice? If you want to eat healthier foods, but you're on a limited budget, it's hard to afford it. I remember a patient of mine at Harborview when I asked him about his diet and said, well, I don't have much money, and if I buy high-calorie, fat food, I fill up faster for less money. And I can't, if I were to eat fruits and vegetables, it's much more expensive, and I'd be hungry. So I don't want to be hungry, so I don't have a choice in how I shop for that. If you want to walk, but your community doesn't have sidewalks or you're afraid for your safety when you leave your door, you're not going to go out and take a walk and get physical activity built into your lives. So let's take a little walk through some of our communities and look at some of the features that might promote health or might detract from health. And then that might suggest some of the things that we can all do together collectively to make our communities healthier places. So if you live in a community where the most available food is fast food, where if you go to the stores, it's a convenience store where the aisles are lined with junk food, that's what is available to you and that's what you'll eat. As opposed to a community where you have a supermarket with full service and there's nice fruits and vegetables to buy, that becomes more easy to eat, have a healthy diet. How about our schools? If you go to schools and the food looks like this, where it's again energy dense, full of sodium and fat, the diet's not going to be great. On the other hand, you find some schools and they have salad bars and kids can eat really healthy food and they actually participate at higher rates actually in the school meal program. Or where do our kids, our youngest kids, spend the time during the day? Are they spending it at home in front of a screen perhaps, or are they spending it in a site with high quality early education and childcare support? And what kind of food is served even at some of these childcare centers? Is it going to be junk food, which is not necessarily, is all too common, or is it going to be healthy foods here? Like for example, on the bottom there, it's a picture of a healthy food box coming from local farms that gets delivered each day to the kids at childcare. If you live in a community which has streets like this, no sidewalks, no bike lanes, full of cars, it's really hard to walk and bike and get physical activity built into your day. Whereas if you live in a community like that on the left, where there's separate bike lanes and it's easy to walk because they're nice sidewalks, you'll be more physically active. So all of this is to say that these conditions, as we talked about, community design, housing, if you live in substandard housing, this is a project I was involved in with the Seattle Housing Authority, where this is what public housing looked like in West Seattle 15 years ago. It was deteriorated, moldy, full of cockroaches and pests. People with asthma were getting asthma exacerbations and ending up in the emergency department. Rebuilding it with healthy homes ended up reducing asthma rates and depression and people doing much better. So I think the housing is another example of one of these factors. And finally, when you look around, are people isolated? Are they at home, kept in, without friends and support, which is associated with depression, heart disease, and a range of other health problems? Or are they connected? And can they join groups where they walk? This is a walking group that the health department started in a community. So people get out together and walk and have social interaction at the same time. What kind of media and advertising are people exposed to in their communities? That shapes their choices. Are they seeing ads for soda and junk food? Or are they seeing ads that you shouldn't be drinking soda and junk food and instead be drinking water and healthier items? And if we take the next step in peeling back the onion and look at what underlies these communities in the fabric and looks at why low-income people, potentially, and people of color also tend to have worse health outcomes and to explain some of our health disparities, what can we say about access to jobs versus being unemployed? What can we say about the distribution of wealth and income? Because inequality in wealth and income is strongly associated with health outcomes in a community. What can we say about the presence of racism in a community and how that, because that also is associated strongly with adverse health outcomes? So all of these factors influence our behaviors, influence our health, and are really the bread and butter of what we need to do to make our communities healthy by taking these on. The Institute of Medicine, now called the National Academy of Medicine, is a congressionally chartered organization that advises Congress and the nation on science and health. Their conclusion is that it's unreasonable to expect people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. So while making affordable healthcare accessible and quality healthcare available is critical, and the biggest improvements in health are going to come from working together to make places healthier. So it means engaging civically in our communities through collective action to implement policies, to change the systems in our communities, and build healthy communities. So I think we've seen some examples, just from the slides I've already shown you, of how we can make food in the schools healthier, and there's been a lot of progress there. How we can make campaigns around healthy eating and drinking water instead of soda, so to spread that message. How we can build community and generate social support. How we can provide support for the youngest kids through early childhood and education. How we can make walkable, bikeable communities. All of these, we have ways to go in King County to make sure all our communities enjoy these same benefits. I'll end with these examples of what we can be doing, just with a few examples from my current work in healthy food policy, making it easier to find and eat healthy food and avoid junk food. So one strategy is food subsidies. As I mentioned before, low-income people have a hard time affording fruits and vegetables and other healthier foods. The city of Seattle, for example, now has a program called the Fresh Bucks program, which matches for every $10 you spend, it gives you another $5 to go spend in a farmer's market or a supermarket or a neighborhood grocery store on more fruits and vegetables. So it is essentially a price discount for getting healthy food. We need to expand this so more people can take advantage of it. On the flip side, if we want to decrease exposure to some unhealthy foods, one policy that's making a lot of progress both in Seattle and around the country is taxing sugary drinks. So Seattle implemented a sugary drink tax starting in January. It's raising the price of sugary drinks, and the intended consequence will be that because they're more expensive, people will drink less, and they'll drink more water, and they'll be healthier. And that's what we expect to see as the evaluation evidence comes out. But it's also raising substantial money, so $10 million in the first 6 months. And the city's investing those funds in early education and in healthy food subsidies, so to support the kind of policies that I just mentioned. So it's a win-win all around. And the last example I'll give actually comes from out of our country in Chile, where there's very high childhood obesity rates. This is Tony the Tiger and Frosted Flakes in Spanish in Chile. And what the government in Chile did is they adopted regulations saying that you can't use cartoon characters on your cereal package to market to kids, and foods that are high in fat, high in sugar, high in sodium, high in calories, get those black warning labels on them so people are aware that they're unhealthy. The sales, Tony the Tiger is more lonely now in Chile than he was before. The sales are down, and actually, Kellogg's is reformulating this so that they can get rid of those black box labels by dropping the sugar content and the calorie content in their products. So a win for everybody again. So to conclude, how do we make this happen here in King County? Well, we can invest in building healthy communities with our time and energy. And we can focus these investments on the communities that have the most burden of chronic disease and illness, like in South King County. We can encourage industries to behave responsibly and take responsible for the health consequences of their products. And if they don't, we can implement policies that require them to do so. So we need to get out and vote. We need to get involved in our community. We need to make connections. We need to get involved in neighborhood planning and design processes. We need to get to know our neighbors and build social connections and social support and capital in our communities. We can support the Y, which does all of these things in our communities across King County. And the Y is a leader in helping build healthy communities by moving these kind of actions forward. So it's really a great pleasure to have been here with you tonight to kind of share some of this vision for what healthy communities in King County can be, and to really recognize the critical role that the Y has played in helping bring this vision a little bit closer to reality. So thanks very much, and it's been great sharing a little time with you.